Hello students, today we will discuss about the muscles of the arm. Now in the arm we will see the muscle on the front compartment as well as on the posterior compartment of arm. Now what are the muscles you will have and how this compartment is divided into this area divided into the compartments. So when you will see the arm is also having the deep fascia, like you have the deep fascia in lower limb which is known as fascia lata. In the same way you have the deep fascia in the upper limb also, and you know that deep fascia provides shape to your limb, and this deep fascia encircle your arm and it gives the extensions which are known as intermuscular septas. Now in this diagram you can see that this is your fascia. Now this deep fascia is sending the septa. Now this septa will go and it will attach to the border of humerus. Now you know that in the lower part of the humerus you are having the two lines, one is known as lateral supracondylar ridge, another is known as medial supracondylar ridge, and this is the outer circumference of your deep fascia. So what is the arrangement? That this deep fascia is sending the septa and this septa is going to attach on both the side to your borders of humerus, which are more prominent in lower part and they are known as supracondylar ridge. Now this supracondylar ridge which is providing the attachment to these extensions are known as intermuscular septa. That means you have the muscle on both the side, that's why it is known as intermuscular septa. Now in this way what you are able to understand that the upper limb the arm is divided into the two compartments, one is anterior compartment, one is posterior compartment. Now posterior compartment is having single muscle is known as triceps, while anterior compartment is having three muscles. So this is the one thing which you have to understand, that how the intermuscular septas are arranged in the arm. There are medial and lateral intermuscular septa. Medial septa attached on the medial supracondylar ridge and medial border, lateral will arranged into the lateral side. Now these septas dividing this arm in two parts, anterior compartment is known as flexor and posterior compartment is known as extensor compartment. So this is the basic thing which you have to understand. Now the anterior compartment, as I already told you, there are three muscles. What are the name? Coracobrachialis, brachialis and biceps brachii. When you will see the anterior compartment, you realize that anterior compartment is further divided into the two parts by a transversely placed or horizontally placed intermuscular septum. Now what is the meaning? That this is your circumference of the arm. In the arm you are having this bone is known as humerus. Here you will have the lateral and here you will have medial intermuscular septa. Now in the anterior compartment you are having one more horizontally placed septum. Now this is the horizontally placed septum, or you can say transverse septa. Now with the help of this transverse septa, this anterior compartment is further divided into the superficial and deep part. Now in this superficial part you are having the muscle is biceps brachii and here you will have the muscle is brachialis. So this is the important thing to understand, that this transverse intermuscular septa separates the biceps brachii from brachialis. So brachialis is a deeper muscle and biceps brachii is a superficial muscle in the arm. Now the one more thing is that all the three muscles of anterior compartment, that means in this compartment you are having a single nerve that is known as musculocutaneous nerve, while in the posterior compartment you have single muscle is known as triceps brachii, and this triceps brachii is supplied by radial nerve. So this is the important concept to understand, that there are two nerves in the arm, anterior muscles of the arm supplied by musculocutaneous, posterior muscles of the arm supplied by radial nerve. Apart from that, in the posterior compartment you have only single muscle is triceps, while in anterior compartment you have the biceps, coracobrachialis and brachialis. Now here you can see that this is your brachialis, which is a deeper muscle, and this is the cut margin of the biceps, which is a superficial muscle. This is a coracobrachialis, which is present on the medial side of your arm. So these are the three muscles: coracobrachialis, brachialis, and biceps brachii. Clear? Now, in this section, now this is the section of the arm. Now, when you will take the section of the arm, you are able to understand that this outer white color is your deep fascia. Now, this deep fascia is enclosing the whole upper limb. Now, here you can see that this is the section of your humerus. Now, anterior to the humerus, you are having deeply placed brachialis muscle. So, this is brachialis. Now, superficial to the brachialis, you are having the muscle is known as biceps brachii. So, where is the biceps brachii? Now, this muscle is your biceps brachii. So, now you can understand that in anterior compartment, you are having the two placement. One is the deeper placement of brachialis and superficial is biceps brachii. Posteriorly, you are having a single muscle which is known as triceps brachii. Now, we will see one by one each and every muscle. First is coracobrachialis. Now, there are two words in this muscle, coraco and brachialis. Now, coraco indicate its origin. It comes from the coracoid process of scapula. Now, the important concept about this muscle is that this muscle is morphologically represent the medial compartment of arm. Now, when you will see the arm, I told you there are only two compartments, front and back. Now, this front is known as flexor and posterior compartment is known as extensor. But this coracobrachialis lies on the medial side and it represents the medial compartment of arm. Now, when you will see the thigh, when we are comparing the upper and lower limb, in the thigh, you are having the femur. So, suppose this is your femur bone, and on the posterior linea aspera, you are having the intermuscular septum, which are 3 in number. In upper limb, you have 2 intermuscular septum. In lower limb, thigh, you have 3 septum. Now, because of this, you are having the anterior compartment where you have the quadriceps femoris. You have posterior compartment where you have the hamstrings, and this is the medial compartment in your thigh where you have adductors. Now, adductors are actually forming the medial compartment. Now, here in the arm, you don't have the adductor compartment, and that's why we are saying that this medial compartment of thigh is coracobrachialis of the medial compartment of arm. Clear? That means when you will talk about the action of coracobrachialis, it is also a adductor. It is also a adductor. Why adductor? Because you have the medial muscle on the thigh which are adductor in nature. So, we are comparing this thigh and the limb, and that's why you have it become easy to understand that this coracobrachialis is also a adductor and it is comparable with the medial part of thigh. Now, what is the origin now? So, I already told you that it comes from the tip of coracoid process of the scapula along with the short head of the biceps, and it insert on the humerus, but on the middle 5 centimeter on medial border. Now, here you can see that this is the coracoid process. Now, this coracoid process is hidden by the anterior fibers of deltoid. So, once you will remove this anterior fiber of deltoid, you can see the origin from this coracoid process. Now, this origin is going downward, the fibers, and they will reach up to the medial side of humerus. Now, at this medial side of the humerus, on medial surface, you will have the insertion of coracobrachialis, and at the same level on the lateral side, you are having the insertion of deltoid also. So, whenever you are having the humerus in your hand in exam, how to locate the site of the insertion of coracobrachialis? For that, you can first locate the attachment of deltoid on deltoid tuberosity. Almost at the similar level, you will find on the medial side the insertion for coracobrachialis. Clear? Now, what is the nerve supply? I told you all the muscles of the front of arm supplied by musculocutaneous nerve. Now, we will talk about the action. Now, I told you that it is comparable with the medial compartment of the thigh. So, medial compartment is adductor compartment, so it is a adductor, but it is a weak adductor of the arm, and it is a weak flexor of the arm. Now, in this diagram you can see one very important concept of coracobrachialis, which is very commonly asked question in exam, that how to identify the musculocutaneous nerve. How to identify musculocutaneous nerve? Now, you know that musculocutaneous nerve arises from the lateral cord. Now, in this diagram you can see that as soon as the nerve will arise from the lateral cord, it is passing laterally, and it is you can say that it is emerging out from this muscle. That means the coracobrachialis is pierced by the musculocutaneous. So, if you have to identify the musculocutaneous, you have to trace it a little bit in the downward course, and if it is piercing a muscle, it has to be the musculocutaneous nerve. Vice versa, if a muscle is pierced by the nerve, then it has to be the coracobrachialis in the upper part of the arm. So, when you are identifying the structure here in the upper part of the arm and you have to identify the musculocutaneous, it is very important landmark that if the nerve is piercing a muscle and the muscle is arising from the coracoid process, then the name of the nerve is musculocutaneous and name of the muscle is coracobrachialis. Clear? Now we will talk about the action of coracobrachialis. Now, in this you can see that this is your abduction and this is the adduction. Now, when you will see the adduction is mainly caused by the pectoralis major and latissimus dorsi. These are the powerful adductor of your upper limb, but this adduction is supported by the coracobrachialis. So, coracobrachialis is a weak adductor because it lies on the medial side of your limb. It helps to pull the limb towards your midline. So, it is a weak adductor. Now, the second action is that it is a flexor of your upper limb. Now, when you will see the action, now this is your flexion of upper limb. Now, this flexion is again mainly caused by the anterior fibers of the deltoid that we have seen in the earlier classes, but it is also assisted by this coracobrachialis. So, there are two actions of the coracobrachialis. One is adduction, which is a weak adduction, and second is the flexion at shoulder joint. Now, there are some very important facts related to this muscle. First is that coracobrachialis is pierced by the musculocutaneous nerve. That is why it is known as Caesar's perforated muscle. Now, this is a one-liner question which you have to remember. Which muscle is known as Caesar's perforated muscle? Now, you know that you have the perforated pipes. You have the pipes in the market, those are having multiple holes. These pipes are known as Caesar's perforated pipes. In the same way, here you are having a muscle which is pierced by a nerve. That is why it is known as Caesar's perforated muscle. Now, the second important thing is ligament of Struthers. Ligament of Struthers. Now, this ligament of Struthers is sometimes known as third head of coracobrachialis. What is that? It is known as third head of coracobrachialis. Now, when you will see the coracobrachialis, it is said that there are two head of coracobrachialis. This is the one head and this is the another head. Now, these two head are arising from the one point and the nerve is passing between the two heads. The nerve is passing between the two heads of coracobrachialis. So, this is the one head, this is the another head, and nerve is present between the two head. Later on, both the head join together. That is why it looks like that the nerve is piercing the muscle. But earlier it is said that there are two separate head and nerve lies between the head. But later on, the both head merge with each other. So, it is said that it looks like the nerve is piercing. That is why this ligament of Struther is the third head. Now, when you will have this third head, now sometimes in the bone we are having a projection here. Now, this projection lies on the medial side, which is known as trochlear spine, and from this trochlear spine to the medial epicondyle you are having a connection, and this is a fibrous band, and this fibrous band is known as ligament of Struthers. Clear? So, there is a question about the coracobrachialis, that coracobrachialis is pierced by which nerve? Answer is musculocutaneous. You have the question Caesar's perforated muscle, answer is coracobrachialis. You may have the ligament of struther in exam. What does it mean? So, ligament of struther is occasionally present, which is a connection from trochlear spine to the medial epicondyle, and morphologically coracobrachialis muscle has two heads and the musculocutaneous nerve passes through these two heads, and the struther's ligament represents its third head of the muscle. Clear? Now, the next muscle is biceps brachii. Now, when you will see the biceps brachii muscle, the biceps brachii is having two heads, that is why the word comes biceps. Now, there is a long head and there is a short head. You know that long head arises from the scapula, so it comes from the supraglenoid tubercle and it comes from the adjacent glenoid labrum of the joint. Now, here you can see that this is the supraglenoid tubercle. So, the long head arises from the supraglenoid tubercle and you have the glenoid labrum of the capsule, your shoulder joint. Then you will have the short head I just told you it comes from the tip along with the coracobrachialis. So, these are the two bony landmarks about the origin of biceps, which is coming from the scapula. Now, there are some important things which you always keep in mind about the long head, that this long head, once it will take origin, it passes through the synovial cavity of shoulder joint. Now, what does it mean? It means that the origin of the long head is intracapsular. Now, this is very commonly asked question. So, when you will see the origin, it is not visible in this diagram. Why not visible? Because the origin which has to be here from the supraglenoid tubercle is now not visible as it is covered by the capsule of shoulder joint. So, here you can see this white color structure, it is the capsule of the shoulder joint and it is enclosing your glenoid cavity also. That is why the origin of your long head, which has to become like this, is not visible and it is known as intracapsular origin. Now, when the tendon will come out, it is surrounded by the synovial membrane. So, you can see that this tendon is having this green color covering and this green color covering is covering of synovial membrane. Now, it emerges beneath the transverse ligament at the upper end of intertubercular groove. Now, this is very important question, transverse ligament. Now, this is the transverse ligament. Now, when you will see the transverse ligament, this transverse ligament is connection between the medial and lateral lip of intertubercular sulcus. Now, here you can see that this is the capsule of your joint, and because of this capsule you are not able to appreciate the origin. Now, here you can see the exit of your long head of the biceps, which is coming out along with this green color sheet, which is the synovial membrane. Now, here in this diagram you can very well appreciate the appearance of transverse humeral ligament. Now, this transverse humeral ligament is connecting this medial lip of intertubercular sulcus with the lateral lip, and that is why this groove is now converted into a canal. Now, through this canal, the long head which will arise from this supraglenoid tubercle cover the upper part of the joint, and then it enters into this canal and then it will come out downward from the canal. So, this is the important concept to understand, that this is the passage or this transverse humeral ligament convert this intertubercular sulcus into the canal. So, this transverse humeral convert the sulcus into the canal. So, what is the function of this ligament? The function is that it holds the long tendon inside the sulcus only, because when you are doing the movement, when the abduction will take place, there are high chances that the tendon will come out from its place and it will have the misplacement of the tendon. So, to avoid that misplacement during the movement, the transverse humeral ligament keep this long head of biceps in its own position. Clear? Now, here you can see how the tendon will come out. Now, so this is the canal which is converted by the transverse humeral, and you can see now the tendon is passing through this canal. Clear? So, this is very commonly asked question in your exam. what is the action of transverse humeral ligament. So, there are two things which you have to write. The transverse humeral ligament converts the bicipital groove into the canal. Second, through this canal, the long tendon of biceps brachii passes, and this transverse humeral ligament keep this tendon into its own position. Clear? So, this is the two things which you have to keep in mind about this ligament. Now, what is the insertion of biceps? Now, again the insertion is very important. Now, when you will see the insertion, both head of your biceps join in the middle of your arm and it form a fusiform belly, and there is a flattened tendon at the lower end. Now, this flattened tendon rotates. What does it mean? That the tendon is not going vertically downward, but it rotates. And where it rotates, laterally or medially? Answer is laterally. Why laterally? Because it will go towards the radius. So, this rotates or take a turn laterally, and when it is taking turn laterally, the anterior surface turn laterally. That means, this is the tendon and it rotates like this. There are two ways, that this is the anterior surface, this is the posterior surface. So, turning may be occur like this. Now, if the turning is taking like this, then anterior surface become medial, but the turning is taking like this. So, what will happen? The anterior surface become lateral surface, anterior surface not become medial. So, this is the question to understand, that sometimes you have this multiple choice question when the biceps tendon is turning, the anterior surface become lateral or anterior surface become medial. Answer is anterior surface become faces laterally. So, the anterior surface faces laterally, and then it ultimately insert on the posterior part of the radial tuberosity. It insert on the tuberosity of the radius. Clear? But not anterior part, on the posterior part. Now, here you can see that this is the radial tuberosity. Clear? And this is your inner surface, and you can see that this tendon is going on the posterior part of your radial tuberosity. So, this is again the question, that insertion take place at anterior part or the posterior part. Answer is posterior part. Then what is the structure lies on anterior part? Answer is bursa, and that bursa prevent the friction between the tendon and bone. So, now there is one more important part of the biceps tendon, that is bicipital aponeurosis. So, what will happen, that the medial side you are having a expansion, and that aponeurotic expansion is known as bicipital aponeurosis, and this bicipital aponeurosis goes medially and it merges with the deep fascia of your forearm, and with the help of this deep fascia is ultimately insert on the upper end of the posterior border of ulna, and it separates the median cubital vein from the brachial artery and median nerve. So, when you will see this diagram, you can see that this is the routine insertion of your biceps on the radius, but from its margin you are having this expansion, and this expansion is known as bicipital aponeurosis. Now, when you will have the placement of the deep fascia of the forearm, you can see that this bicipital aponeurosis ultimately merge with this green color outline, which is the deep fascia, and with the help of this deep fascia, it ultimately attached on this posterior subcutaneous border of the ulna, which you all can feel on the posterior side of your forearm. Now, here these diagrams are showing very important part of the bicipital aponeurosis. Now, here you can see that when the bicipital aponeurosis are going from this biceps tendon, it is covering the two very important structure. Now, you can see that this red color is your brachial artery, and on medial side you have this yellow color median nerve. So, whenever you are doing the dissection in the cubital fossa, and as soon as you will remove this bicipital aponeurosis, then and then you are able to appreciate the biceps, then you will have the brachial artery and median nerve. Now, superficial to this, what you have? You have this median cubital vein. Now, in this diagram, you have to understand that this is the plane of your bicipital aponeurosis. Clear? Now, superficial to this, you are having median cubital vein, and deep to this, you are having the brachial artery and median nerve. So, you have this question that bicipital aponeurosis separates which structure? Answer is median cubital vein, which is a superficial, and brachial artery and median nerve, which are the deep structure, clear, and in between you will have bicipital aponeurosis. So here you can see that this connection, which is known as median cubital vein between the basilic and cephalic veins of your upper limb, you can see that we are using this vein for intravenous injection because it is supported from below by a tough structure which is known as bicipital aponeurosis. So in nutshell, whenever you are having the bicipital aponeurosis, there are two things. First is that it is expansion from the medial side of the biceps tendon. Second thing, it lies between the median cubital vein, that is superficial, and median nerve and brachial artery, which are the deep to the bicipital aponeurosis. Now, it is supplied by again musculocutaneous, because whenever you are having the muscles of the front of arm, you have only single nerve. Now, what are the actions of the biceps? Now, biceps is having supination, it is having the powerful flexion at the elbow joint, it is having some weak action at the shoulder joint also, because there are two joints which has been crossed by this tendon. Now, this is the shoulder joint, and you can see that this long head which is arising from your supraglenoid tubercle is crossing the joint from upper side. So, because it is crossing from the upper part, the one action is that long head supported the humerus from the upper side, but it is crossing this joint, so the action is also visible here, but the main action comes in the lower area where it is crossing the elbow joint. So, what are the action? First is the supination, second is the flexion. Now, flexion is very simple. Now, this is the flexion of the elbow joint, which is caused by the two muscles, brachialis and biceps brachii. Flexion at shoulder joint, so this is the extension, this is the flexion. So, again the flexion is a very weak action because it is again having very small component here in relation to the action, and the long head prevent the upward displacement of the shoulder joint. Why? Because this long head is having this support here, so the upward displacement is not possible. That is why it is said that shoulder joint is having tendency to the downward dislocation, clear. Now, we will see these two main action. First is the supination. Now, when you will see the supination, you have to first understand the pattern of insertion. Now, for that we have these subsequent diagram. Now, here you can see that you have to first take the section. Now, if you can see here, this is your tendon of biceps, and there are one more muscle which is adjacent to this is supinator. So, I have taken the section at this level. Now, once you will take the section at this level, and if you will zoom it out, what is the important thing we are able to understand? That this is the radius and this is the ulna. Now, this is your radial tuberosity, on which you can see that this is the insertion of your biceps, and on the posterior side you are having this supinator. This muscle is supinator. Now, what will happen? Because of the turning, we have seen the insertion of biceps. The biceps is not going straight, it is having a curvature, it is having a turning at the lower end. And because of this turning at the lower end, what will happen? That once you will have the pronation, the fibers will pull and they will take out the radius in its neutral position. So, that is known as supination, which is a combined action of the biceps as well as the supinator, which is present on the posterior side. So, both these muscles are responsible for outward movement of the radius, because biceps is pulling it and supinator is taking it laterally, and biceps is pulling from upward direction. So, in both the way you are having this kind of the movement. So, here you can see first is the supination, where you have to understand that this is the my left side, and once the supination will take place, what should be the position of the radius. So, radius, this is the pronation when this lower end of the radius comes in the medial side, but when the supination will take place, I have to pull at here. Now, when you will pull this, the radius will go on the outer side. So, that you can appreciate. Now, this is your pronation. Now, what will happen? Now, this is pulled by the biceps, and once the biceps is pulling this radius along with the supination, the radius is rotating back to its neutral position. That you can appreciate here very well. So, this is what is known as supination caused by biceps, clear. So, this supination is taking place at the radio-ulnar joint, clear, and at this radio-ulnar joint, which is a pivot variety of joint, you are having this type of the movement of the radius, and this movement is known as supination. This is pronation and this is supination. So, supination is caused by the contraction of the biceps, and this contraction is responsible for outer rotation of radius. Now, this is the flexion. Now, here you can see that this is the extension, which is an action of triceps, and this is the flexion. And this flexion is not only caused by the biceps, but it is also with the brachialis, and here you have some role of brachioradialis. Now, this is the action where you have at the shoulder joint. Now, I told you that it is a weak flexor of the shoulder joint. So, when you will see this yellow color tendon is the long tendon of the biceps brachii, which comes in this action. Now, what is the brachialis? Now, brachialis is again a muscle of the arm which lies deep to the biceps brachii, and it arises from the anteromedial and anterolateral surfaces of the humerus. Now, see, this is the two part, this is the midline, this is the medial border, this is the lateral border. So, this become the anteromedial and this become the anterolateral surface of the humerus. So, when you will see the origin, now here in this diagram, you can see that this is the origin from the two surfaces. Now, this is your one part of the brachialis and this is the another half of the brachialis. And this brachialis lies deep to this biceps brachii. So, this is the superficially placed biceps brachii, and deep to that you will have the brachialis, which is lies on the two adjacent surface of humerus. So, humerus in the lower part is having the anteromedial and anterolateral surfaces, and these surfaces are providing the origin of the brachialis muscle. And this brachialis form the bulky muscle that lies posterior to the lower part of biceps brachii. Now, when we will talk about the insertion of the brachialis, you should have idea about the upper end of the ulna. Now, in this upper end of the ulna, you can see that this projection is known as coronoid process. What is that? Coronoid process. And below the coronoid process, you are having the ulnar tuberosity. So, once you will have the ulna in your hand, you should first keep this thing in mind that there is a small projection, and this projection is known as coronoid process, and below that you are having the roughness, and this roughness is known as ulnar tuberosity. So, on the anterior surface of coronoid process and ulnar tuberosity, you are having the insertion of your brachialis muscle. So, brachialis muscle insert on the coronoid process and ulnar tuberosity of ulnar bone. Now, what is the nerve supply? Now, the nerve supply of brachialis is become important because there are two nerves which are supplying it. The major comes from musculocutaneous. The major nerve supply is musculocutaneous, but the radial nerve also supply its lateral part, which is very small. Clear? And what is the action? It is a flexor. So, for this nerve supply, you can see here that this is your musculocutaneous nerve. How to identify musculocutaneous? I just told you that it is piercing the coracobrachialis. Now, after piercing the coracobrachialis, it lies deep to the biceps. So, we have removed the biceps brachii. After removing the biceps brachii, you are able to see the brachialis. So, this now lies on the brachialis, that means between the biceps and brachialis. So, but obviously it is going to supply this muscle when it lies on the brachialis. But when you will see the radial nerve, if you will rotate this body and you will see the dorsal side or the posterior part of the limb, you will see that there is a long nerve which is known as radial nerve. Now, this radial nerve, once it will come on the lateral side, it will supply this small portion of the muscle also. So, there are two nerve supply of the brachialis. The major nerve supply comes from the musculocutaneous, but the radial nerve which is coming from the posterior side will also supply the small lateral part of the muscle. Now, what is about the triceps? Now, you know that triceps is a muscle of the back. Now, as the name suggests, it is having three head, that is why it is triceps. So, what are the three head? Long head, lateral head and medial head. Now, when you will see the three head, the long head comes from the scapula, while the lateral and medial head comes from the posterior surface of humerus. Now, this long head arises from the infraglenoid tubercle. So, this is the area of infraglenoid tubercle, or you can say how to locate this on the upper part of lateral border of scapula. Now, when you will see the dorsal surface of the humerus, the students are having the confusion about the origin. So, my dear friends, you have to first locate the radial groove. So, this is the radial groove, and radial groove is a very important feature on the dorsal surface or posterior surface of the humerus, which is having the radial nerve along with the profunda brachii artery. Now, this upper border is known as upper ridge of your radial groove, and this is the lower ridge of radial groove. Now, there are three heads of triceps. One is coming from the infraglenoid tubercle, second comes from this ridge, second comes from the ridge, and the third head comes from this surface. So, you have to keep this thing in mind that if I have to draw the origin of the triceps, I will draw three areas. One is infraglenoid tubercle, which is the narrowest origin. One is the broad origin from the ridge, and third origin is from the surface. And what surface? Posterior surface of the humerus below the medial lip or medial ridge. So, this will become the lateral head, this will become the medial head, and this will become the long head of your triceps. Clear? So, long head comes from the infraglenoid, lateral head comes from the oblique ridge. Which oblique ridge? Lateral oblique ridge or upper oblique ridge, and the medial head comes from the posterior surface. So, the surface is providing the origin of medial head. So, this is the laterally placed ridge, so it is lateral ridge, this is the medial ridge and the surface. Clear? So, whenever you are drawing the origin of triceps, please be specific about the origin. Now, here in these three diagrams, you can see that this is the long head which is coming from the infraglenoid tubercle. Now, this is coming from the ridge. So, this is the lateral head, and this lateral head is placed on the lateral side or lateral border of the triceps. But you are not able to see the medial head. Why? Because medial head is below the lateral head. And to see the medial head, you have to see the anterior aspect of the triceps. So, when you will see anterior aspect of the triceps, now you can see this is the medial head of the triceps. So, this is the lateral head which is coming from the lateral ridge, this is the long head which is coming from the infraglenoid tubercle, and this is the medial head which is coming from the posterior surface of your humerus. Now, what is the insertion? Now, again when you are reading the insertion, you have the idea about the olecranon process of ulna. Now, this projection is known as olecranon process of ulna, which is having the ventral or anterior surface and dorsal surface, and it is having the superior surface. So, this muscle insert on the superior surface of olecranon process. So, this is the point of insertion, that is the superior surface of olecranon process, which you can appreciate here. So, this part is receiving the insertion of triceps. So, what is the origin of triceps? From scapula and humerus. What is the insertion of triceps? From on this part of the olecranon process of ulna. Now, the nerve supply of the triceps. Triceps is mainly supplied by the radial nerve, and radial nerve is a dominant nerve on the back of the arm. Now, there is a one question related to the radial nerve injury, that if the spiral groove injury will occur, there is no complete paralysis. That means the part of the muscle is still working. If the radial groove injury will occur, still the patient is able to do the extension. So, this is the radial groove. Now, why it happens? Because this is your origin of the long head. Now, the nerve is already supply this muscle here only, and if the injury will take place in this area, which is the area of the radial groove, still you can see that this part is already received the nerve. In the same way, this part is also receiving the nerve, which is the medial head of your triceps. So, because the medial head and the long head already been supplied by the nerve before it enters into the radial groove, that is why the complete paralysis of the triceps will not occur. Clear? So, these are some important facts which you have to keep in mind. So, at the end of this class, now you know first what is the meaning of the flexor compartment and extensor compartment of the arm, which are the muscles present in these two respective compartments, and what are the nerve supply of these muscles. So, this is all for today's class. Thank you.